Thank you so much, Dr. Ayla. I'm sorry I had to push you because of, in the interest of time, but I'm sure that all of us really enjoyed your interactive manner, and he has already mentioned that we can all connect to him by using technology on internet. Now, on schedule, it was supposed to be Dr. Amrita Sharma's talk, but she's held up with another lecture. So we are going to have Professor H.K. Tewari Gold Medal Prelims to go with right now. And we'll quickly finish this as we wait for Dr. Namrata. You all would be given a blank paper. All right. So I assume that all of you have a blank paper. Please write your name, the institution or college that you belong to. This is for postgraduates only. This quiz is for the postgraduates. So please write your name, the institution or a college that you belong to, and very importantly, your mobile number. Please mention your mobile number. There have been instances in the past where we had to, the candidate lost out on the finals because we couldn't clarify with him or her as to what the answer was. So please write your name, institution or college that you belong to, and your mobile number on the right hand corner. The prelims is comprising of multiple choice questions. Only one choice is the right answer, so they are not please remember, for each of the question there is only one right answer, and the marking pattern is, if you get it right you get +2. If you get it wrong, you get -1. If you don't attempt, you don't lose any mark, you don't gain any mark. So remember, it's +2 for the right answer, -1 for the wrong answer, and 0 for no attempt. Has everybody got the paper? Please raise your hand. Please raise your hand. The people who have not got the paper, please raise your hand so that we can quickly give you the papers. Please raise your hand. Keep it raised now, please. Please keep it raised. You need paper? You got it? All right. All right. So now I believe everybody has got the paper. Let's begin the H.K. Tewari Gold Medal Quiz Prelims. The finals will be conducted in the evening. So all the best to all the candidates. We have some exciting prizes and of course a prestige of winning a gold medal in AIOS conference. This is question number 1. Netamycin may be effective in the treatment of all of the following infectious agents except. Netamycin may be effective in the treatment of all of the following except Aspergillus, Candida, Fusarium, Mucor. Question number 1, +2 for the right answer, -1 for the wrong answer, 0 for no attempt. Netamycin may be effective in all of these except Aspergillus, Candida, Fusarium, Mucor. Question number 2, about the normali, lots of numbers, read them carefully, they're not very difficult. About the normali, which one of the following statement is right? Cornea scatters 20% of the incident light. Option 2, crystal lens of a 20-year-old scatters 5% of the incident light. Option number 3, at the age of 60, normal lens absorbs around 60% of the blue light. Option number 4, index of refraction in the lens is higher in cortex than in the nucleus. Which one of these about the normali is correct? Does cornea scatter 20% of the incident light? Crystalline lens, sorry for the spelling there, 20-year-old scatters 5% of the light. The lens absorbs 60% of the incident blue light at the age of 60, and index of reflection is higher in cortex than in the nucleus. +2 for the right answer, -1 for the wrong answer. Option number 3, who wrote this letter to his father in 1851? There are quite a few clues in this letter that a person wrote to his father. In the next slide I'll give you the option. I had to explain to my students that the theory of emission of the reflected light from the eye was discovered by Brooke. He was very close from the invention of ophthalmoscope. To obtain optical image of the retina, he had only to devise an instrument in which his eye could be placed in line with rays of light entering and leaving the observed eye. Who wrote this letter to his father in 1851, explaining that a gentleman called Brooke was very close to invention of ophthalmoscope. Your options for question number 3 are: was it Purkinje, was it option 2 Helmholtz, was it Duane, or was it Steve Charles? Who wrote this to his father in 1851 about invention? What is Purkinje, Helmholtz, Duane, or Steve Charles? Move on to question 4. And we had lots of knowledge that we gathered about glaucoma. What percentage of patients on medium to high dosage of topical dexamethasone for 6 weeks would develop elevated IOP? What percentage of patients on medium to high dosage of topical dexamethasone for 6 weeks would develop elevated IOP? Option number 1, 20%. Option number 2, 42%. Option number 3, 66%. Option number 4, 79%. What percentage of patients would develop glaucoma if they are put on dexamethasone for 6 weeks? 20, 42, 66, 79. Plus 2, minus 1. Question 5. Regarding thyroid ophthalmopathy, which one of this is a correct statement? Is it seen more in men than women? Commonest extraocular muscle to be involved is lateral rectus. Graves' disease usually progresses for 3 to 5 years and then stabilizes. And option 4, MRI shows enlargement of extraocular muscles involving muscle bellies, origins, and insertion. Regarding thyroid ophthalmopathy, which one of the following statement is the right statement? More common in men than women. Commonest extraocular muscle is lateral rectus. Graves' disease progresses for 5 years and stabilizes. And MRI shows enlargement of muscle bellies, origins, and insertions. Move on to question 6. Diffuse distribution of keratic precipitates can be seen in all of the following except. Diffuse distribution of keratic precipitates on the cornea can be seen in all of the following except herpetic antiuveitis, Fuchs heterochromic cyclitis, phacoanaphylactic uveitis, or glaucomatous-cyclitic crisis. Diffuse distribution of KPs can be seen in all of the following except herpetic uveitis, Fuchs cyclitis, phacoanaphylactic uveitis, or glaucomatous-cyclitic crisis. Question 7, there is a diagram. You have a pituitary gland there and abducens nerve which have not been blocked out, and rest of them are blocked out. I want you to tell me what is structure number 4 here. This is a diagram, anatomical diagram. What is structure number 4? And your options are trochlear nerve, oculomotor nerve, sympathetic pathway, facial nerve. What is structure number 4? Structure number 4, is it trochlear nerve, oculomotor nerve, sympathetic pathway, or facial nerve? Question 8, photograph of a tall young man with long fingers and myopia and periorbital degenerations and glaucoma. So this is a photograph of a tall young man with long fingers, myopia, periorbital degenerations and glaucoma. What are we talking about? What are we talking about? Yeah, but my question is this. What is a false statement regarding that condition? He will demonstrate Walker's sign. He will exhibit Steinberg's sign. The defect is usually on chromosome 15. Chances of his relatives having same problem is very, very low. That patient would show Walker's sign, would show Steinberg's sign. The defect is on chromosome 15, and chances of his relatives having the same problem is very, very low. Question number 9. This is a photograph and you can clearly see what is happening here. This is a photograph of a patient who is on some oral medication for her systemic ailments. Once you have a look at a photograph of this corneal condition, what I want you to tell me is she is more likely to be having medication for all of these except. So she is having this on the cornea, and she is likely to be having medication for any of these except. Was it rheumatoid arthritis, cardiac arrhythmias, breast cancer, or pseudoxanthoma elasticum? Except. So she is likely to be having medications for all of these except one of it. Move on to question 10. Vertical gaze palsy is the feature of. Vertical gaze palsy is the feature of. Is it fourth nerve palsy, Steve Richardson syndrome, internuclear ophthalmoplegia, or wall-eyed bilateral internuclear ophthalmoplegia? Vertical gaze palsy is the feature of fourth nerve palsy, Steve Richardson syndrome, INO, or Webino. We move on to question number 11. Ingestion of all of the following can cause optic neuropathy except. Ingestion of all of the following can cause optic neuropathy except isoniazid, methanol, ethambutol, ganciclovir. Which of these would not cause optic neuropathy? Is it INH, methanol, ethambutol, or ganciclovir? Question number 12. Have a close look at this photograph. You can see something is happening at the macula. Tell me whether this condition involves the Brooks membrane. Is it autosomal dominant in inheritance? Does it have an X-linked recessive inheritance? Or it's best diagnosed by multifocal ERG? This condition involves Brooks membrane, is autosomal dominant in inheritance, has an X-linked recessive inheritance, or is best diagnosed by multifocal ERG. Question 13, move on to some histopathology. Have a look at this very typical histopathological slide. Which one of the following conditions would you find this kind of picture? Meningioma, basal cell carcinoma, squamous cell carcinoma, pleomorphic adenoma. Where would you see this? Meningioma, basal cell carcinoma, squamous cell carcinoma, pleomorphic adenoma. Question 14. In notations recording visual acuity, 6 by 600 vision amounts to what? In visual acuity recording, 6 by 600 amounts to 3 by 60, 4 by 60, counting fingers at 2 feet, or hand motions close to face. 6 by 600 amounts to 3 by 60, 4 by 60, count fingers at 2 feet, or hand movements close to face. Half a mark, trachoma can cause all of the following except Distichiasis, punctal stenosis, conjunctival scarring, and tropion. Trachoma can produce all of the following except Distichiasis, punctal stenosis, conjunctival scarring, and tropion. What would you not see in patients with sequelae of trachoma affecting the eyelid? Question number 16 regarding optic nerve. Choose the false statement. Which one of these 4 statements regarding optic nerve is wrong? Each optic nerve contains 1.2 million optic nerve fibers. Fibers are covered with myelin, which is derived from Schwann cells rather than oligodendrocytes. It leaves orbit via optic canal and is derived from the outpouching of the diencephalon. Which one of the following statements about the optic nerve is not correct? Move on to question 17. Have a look at the test, and the question will be asked based on this test. This test is based on the principle of spherical aberration, based on the fact that longer wavelengths are refracted more than the shorter wavelengths. Desired endpoint for patients with myopia is patient seeing letters in green better, and is a test for refinement of spherical power. This test is based on the principle of spherical aberration, based on the fact that longer wavelengths are refracted more than the shorter wavelength. Desired endpoint for patients with myopia is patient seeing letters in green better, and is a test for refinement of spherical power. Question 18, we just heard about microspherophakia. Most common presentation is gradual onset problem. Microspherophakia is commonly present with patient is generally tall with long fingers and mental retardation. Pilocarpine is the drug of choice. Cycloplasia is the treatment of choice. Which one of these is correct regarding microspherophakia? Is it more commonly presents to you with a gradual onset problem? Are these patients more commonly tall with long fingers? More commonly. Is pilocarpine the drug of choice, or is cycloplasia the treatment of choice? 19. This is a Greek alphabet. Have a look at it. Which one of the Greek letter? Is it pi? Is it chi? Is it delta? Is it isoptra? What is this? Pi, chi, delta, isoptra. Or Latin and Greek. Question 20. +1 with +2 at 90 is your patient's prescription 6 weeks following an extracapsular cataract surgery. Which one of the following is a false statement? So you did ECC plus IOL for a patient. Patient comes to you 6 weeks following the surgery, and his refractive error is +1 with +2 at 90. Which one of this is a false statement? This is with the rule astigmatism. The spherical equivalent of this prescription is +3. The cylindrical power is due to a tight suture, and transposition of this prescription would be given here. +3 with -2 at 180. +1 at +1 with +2 at 90. Which one of this is a false statement? Is it with the rule astigmatism? Spherical equivalent is +3. This is because of tight suture, and transposition of this prescription will be +3 with -2 at 180. 21. Which one of the following would cause a prominent cherry red spot at the macula? Which one of the following would cause a prominent cherry red spot? Gaucher's disease, neuroretinitis, ophthalmic artery occlusion, intermediate uveitis. Which one of the following would cause cherry red spot? Gaucher's disease, neuroretinitis, ophthalmic artery occlusion, intermediate uveitis. +2, -1. Question 22 about local anesthesia. Choose a wrong statement. Safe dose of bupivacaine is 2 mg per kilogram. Effect of topical proparacaine lasts for about 15 minutes. Effect of injection lignocaine starts by 30 minutes. The onset of action of injection lignocaine is 30 minutes, and parabulbar block can be given with a blunt cannula. Which one of these is a wrong statement? Bupivacaine dose, proparacaine effect lasts for 15 minutes. Effect of injection lignocaine starts by 30 minutes, after 30 minutes. And parabulbar block can be given with a blunt cannula. 23 is a picture of ERG recording showing A and B waves, and which one of these about ERG is correct? Origin of A wave is from Muller cells, B wave is from photoreceptors, ophthalmic artery occlusion will show presence of A wave and absence of B wave, and 30 Hz flicker measures cone function. Regarding ERG, which one of this is the right statement? A wave from Muller cells, B wave from photoreceptors, ophthalmic artery occlusion will show presence of A wave and absence of B wave, 30 Hz flicker measures cone function. 24 is regarding Duane syndrome. Duane syndrome is cited as an exception to Sherrington's law. Number 2, presumed neuropathological cause of Duane syndrome is absence of PPRF. Majority of DS are autosomal dominant, and in 70% of patients with DS, patient will have systemic association. Duane syndrome, which one of this is the right statement? Cited as an exception to Sherrington's law. Presumed cause is absence of PPRF. Majority of DS are autosomal dominant, and 70% of the patients will have systemic association. Question 25. Contusion injury to the globe or periorbital region can cause cyclodialysis, scleral rupture, choroidal rupture, all of the above. Contusion injury or a blunt injury to the globe or periorbital region can cause which one of these? Cyclodialysis, scleral rupture commonly at the limbus, choroidal rupture, or all of the above. 26, last 5 questions for the prelims. Signs of preseptal cellulitis are all except prominent lid crease, sorry for the spelling, presence of pain, erythema, or normal ocular motility. What would you see in preseptal cellulitis? All of these except one. Prominent lid crease, presence of pain, erythema, normal ocular motility. 27. The Egyptian god Horus once lost his eye in battle. The eye was restored by his sister Isis and came to symbolize protection against evil. How is the eye remembered medically today? So Egyptian god Horus, he lost his eye once in battle, and it was restored by his sister Isis, and it came to symbolize protection against evil. How do you remember this medically today? RX, evil's eye, iris, nevus. How do you remember this? RX, evil's eye, iris, nevus. Question 28. What's missing in this logo? Obviously, you need to know what logo we are talking about, and then something has been blanked out. What's missing in this logo? Is it an eye, car, plane, or child's face? What's missing in this logo? Eye, car, plane, child's face. Question 29. Which website predominantly uses blue color, as it is believed that the founder is supposed to be red-green blind? Which website predominantly uses blue color because we believe that founder is red-green blind? Is it Facebook, Center for Sight, Allegan, or LinkedIn? You can all go and check Dr. Vipal's color vision. Yeah. Which website predominantly uses blue color as the founder is supposed to be mild red-green blind? Is it Facebook, Center for Sight, Allegan, or LinkedIn? We come to the last question of the prelims of this H.K. Tewari gold medal, and is this. Achard syndrome is a syndrome consisting of erectodactyly, receding lower jaw, joint laxity limited to hands and feet, hypermobility and subluxations of the joints, increased lateral excursion of the patellas, and other findings. Patients don't have any eye abnormalities or CVS problems, unlike a syndrome which otherwise has a similar patient profile. So there is a long description of a syndrome called Achard syndrome, which has all these features: erectodactyly, receding lower jaw, joint laxity limited to the hands and feet, hypermobility, and whatnot. But only thing Achard syndrome would not exhibit would be absence of any eye abnormalities or absence of any CVS problems. So, what is this other syndrome which has a similar profile and eye and CVS abnormality? Is it Marfan syndrome, Weil-Marchesani syndrome, Loess syndrome, or Alport syndrome? So, Achard syndrome has all of these except eye and CVS. Which one of these that we see has all these features? Erectodactyly, joint laxity, hypermobility, and whatnot. Marfan's, Weil-Marchesani, Loess syndrome, Alport syndrome. And that concludes, ladies and gentlemen, the prelims for H.K. Tewari gold medal. Tidy your paper. May I have volunteer to collect the papers? Volunteers, can you please collect the answer sheets quickly? So what do you think? How was the quiz? Easy or little difficult? Easy? How many of you think you got 30 out of 30? Nobody? Alright. So please stay back for the finals. I have a very interesting final which I and Dr. Santosh will be conducting late in the evening. I know it will be a little late, but it will be a fun quiz. And obviously, as I said, you all will be fighting for Professor H.K. Tewari gold medal. Professor H.K. Tewari was at AIIMS, and he has been the teacher for a lot of prominent ophthalmologists that you see today, including Dr. Maipal, Dr. Santosh, and the host of all people who have come out of AIIMS. And he was very keen on teaching. Unfortunately, he passed away some time ago, and that's the reason why this quiz has been dedicated to Professor H.K. Tewari. Make sure that you have written your name, mobile number, and institution or a college that you belong to. Has everybody submitted the paper? I hope nobody has the paper with them now. Please wait, because Dr. Namrata is going to have her lecture very soon. She is on her way, and we are going to have a lecture on the cornea by Dr. Namrata Sharma very, very soon. What do you think is the answer to this question? Facebook or LinkedIn? Or Center for Sight? Facebook is the right answer. How many of you got this right? Oh, all of you got it. Now let me ask a medical question. Okay, how many of you got this right? What's missing in the logo here? What is this logo of? Which organization? Orbis. Any idea? Orbis. Is it Orbis? There was a little clue here. So this is a logo of Orbis. And if I say it was a logo of an Orbis, then what is missing?
Plane.
Plane, absolutely right. Because Orbis is that flying hospital which takes care of. And what do you think is happening here? Egyptian god Horus. RX, Evil's Eye, Iris, or Nevis? RX is the right answer. Well done. Very well done. What do you think is happening here? Signs of preseptal cellulitis are all except prominent lid crease, because all fluid is accumulated there, so actually you will not find any lid crease there. Very good. Contusion injury to the globe and periorbital region? Volunteer, have you collected all the answer sheets? Yeah, all of the above. Duane syndrome? Which one of this? Everybody knew Facebook. What about this? Alright, so it's an honor to have Dr. Namrata Sharma here and to have her lecture delivered, as she, as you know, is from AIIMS and has been inspirational figure. She publishes a lot and travels around India to teach. So, Dr. Namrata Sharma.